Hi,
Hello.
Sue.
Hello.
Thanks for joining me today. And I'm so happy that you're able to come on here and talk to us a little bit and be able to give some information to the public. I'm really looking forward to this interview, and you and I know each other really well. So I'm just going to jump into it. I'm going to introduce you first. Dr. Fairchild went to medical school at the Medical College of Pennsylvania, which is now Drexel University, and did her residency in family medicine at Montgomery Family Practice in Norristown, Pennsylvania. She did a fellowship in integrative medicine at the University of Kansas. So the purpose of this series is that I wanted to get practitioners on here and clinicians, and I also have interviewed someone that's a mind-body practitioner um, to talk about what people of color or melanated people can do with regard to COVID-19 or the coronavirus in terms of like prevention, avoiding it, or if they do get it, what they can do. So, and I'm so pleased to have you on here because you and I have been doing research together for months.
My
Like,
pleasure. Yeah.
yeah, and I just want to say that you actually sparked me to do the research because you had people that were being affected that were away from the United States. And I wanted to help you. So I started looking up things too. And then, we knew it was in China and I figured that it was going to come here. So now it's here and, we've been on it for several months. So I'm glad that we were able to get ahead of the curve. Oh, that's okay. You can just, whatever it was, it's all right. So I'm gonna go ahead and jump into the questions. Has anyone been diagnosed with the coronavirus?
I would say no. I know at least 2 people who have all the symptoms, but guess what? They haven't been able to get any testing. So, they're suspected, but no one's agreeing to test them. So we don't know. It's pretty sad.
Yeah, I'm gonna forward you the email, but I just got an email last night and I asked them some questions and I'll forward it to you. But I ran into a company that says they have tests and they say that patients can get reimbursed and they claim they're sending me some.
Wow.
So, yeah, so I just asked for, a small amount. I'm not going to say how much I asked for. And there is like the patient has to pay up front, but they can submit it and get they claim that patients are getting 100% reimbursement. So hopefully that'll be fixed soon. How soon do you think all this will be over?
Oh gosh. Hopefully in a few months, but
Mhm.
there are plenty of experts who are saying this could go on and on, like, the seasonal flu. A lot of people feel it's here to stay. So
Mhm.
I think the first, big wave is hitting us now, and that big wave is going to die down. And then we're going to continue from now on to periodically see, maybe seasonal little speed bumps of coronavirus.
What do you think makes one person have mild symptoms and another person have severe symptoms?
I think a lot of factors are involved. Definitely genetics are a factor. There are certain genes that make people, more predisposed to developing a higher fever or, various things like that.
Mhm.
Certainly age is a definite known factor for COVID.
Mhm.
A number of things happen with age. People's, eating habits change. They, get lazy to cook, and so they don't eat as well, or their stomach acid levels drop with age, and they don't digest food as well. They don't absorb as well, and so all their nutrient and antioxidant levels just plummet. They may not sleep as well, and sleep also factors into immunity. So a whole bunch of things. And also, I think initial viral load is another thing. Say if somebody, starts out with, say, one viral particle. I mean, that's an exaggeration.
Mhm.
But then it takes time to, replicate. And so the person has time to fight it off. But say if they get infected right away with, a million viral particles,
Mhm.
they can very quickly get overwhelmed.
And you and I were talking about some of the predisposing factors contributing to like having hypertension and diabetes, asthma. Did you want to say anything else about that? Like,
Yeah, I mean, definitely all those pre-existing conditions, the more support you're going to need with this COVID.
mhm,
Anything like, say, drinking too much depletes the glutathione in your liver. And when a viral illness hits a person, one of the things it does do is deplete the vitamin C and glutathione levels. So if you start out already, with, say, stress in your liver from either alcohol or hepatitis C or something, you're starting out with lower glutathione levels. So it's a bit of a double whammy. And the same thing with, heart disease or diabetes. You've got stress on your organs. And so
mhm.
when you throw in the additional viral infection, it's another double whammy.
And I'll just throw in that I think what all these predisposing conditions have in common is that the people have poor nutrition. They may not realize it, but they probably have increased intestinal permeability or leaky gut. It's also like
Oh,
predisposing.
absolutely, absolutely. The gut is huge.
Mhm.
There's some reports out of China where they said that people who died of COVID were lacking good gut bacteria. So having, healthy gut bacteria also improves your chances.
So that brings me to my next question, which is I know you've written a book called Surviving Coronavirus. And full disclosure, I wrote the foreword to the book. And I've already read the book, even though it was just published just days ago. What motivated you to write the book?
Well, when I first saw how things started in Wuhan, I pretty much figured out it's gonna hit the rest of the world. And people were saying there's no cure. And I was like, there's no cure. No, I don't like this answer. There's got to be a better answer than that. And so I thought about all my friends and all my relatives spread out all over. And I said, I'm not taking there's no cure for an answer. And so I just started out, researching whatever I could, anything that would just help stack the cards in someone's favor. And all of that just ended up in the book.
And who's the book written for?
The book is written for pretty much everyone. There's a lot of science information in that book because, some people are scientists, and any scientist reading that book is going to say, where's the detail? I want to know more.
Mhm,
So I had to put that in there. It's
mhm,
also written for medical practitioners who are
mhm.
wanting to treat people. So I had to put that sort of information in there. But it's also written for the everyday person so that reading it, even if they did not understand the science or the medical information, they would still come out of reading that book knowing what to do for themselves. And the other thing is that, good luck getting testing. I've heard so many horror stories of people who went to the urgent care, went to the ER with symptoms. We're told, oh, you don't have a history of travel. We can't test you. Or we're told, you just have bronchitis. Go home and take some Tylenol. That's not an acceptable standard of care. And so the book is written for all these people who got treated poorly at the ER, who got told basically to shut up and go home. This book is written for them so that they'll have something that they can do to help themselves at home.
Well, thank you. Thank you. And that's a great segue to my next question. I heard Kamala Harris talking about on CNN a couple of nights ago, just bringing up the underserved population, bringing up like health disparities and how nobody's talking about melanated people or people of color, that people of color, of course, are at a disadvantage and may get sick easier because many more of us are on medications or being treated for diabetes, for example, hypertension, for asthma, which are all predisposing conditions. And I saw on LinkedIn, I can't remember the doctor's name, but her focus is on health disparities in people of color and melanated people. And she was talking about, she works in urgent care in New York City, in Brooklyn.
Mm.
And I thought it was really interesting that she noticed, and she's been working through the whole COVID crisis, and she noticed that the criteria for the testing, as you mentioned, they ask about travel and how that is creating a health disparity.
Mm-hmm.
And I think you and I had talked about that like in January.
Yep.
And I was like, wow, I probably should have written it then, because it's true. Like that one part of the question is disparaging. So what can melanated people or people of color do to avoid getting sick?
Apart from all the usual things, including eating well and exercise and all that, I think the big thing is vitamin D, because, that puts everyone with a little darker skin at a little bit of a disadvantage, especially, living in the northern or sub-northern states. I mean, in my practice, I test people from Virginia, Pennsylvania, and all these states. I have yet to find somebody who is not deficient in vitamin D. Unless somebody is religiously supplementing, they are by definition deficient. So it's a no-brainer. Vitamin D, vitamin D3, not D2, D3 is the better form of vitamin D. And I've been recently telling people that, when it's not grass cutting season, that's when you need to step up your vitamin D. So, and it also depends, if you work outdoors as a landscaper, you might not need vitamin D in the summer, but it still doesn't hurt to take a bit. But once, it stops being grass cutting season, that's when you need to step it up.
I think too that vitamin D suffers with when people have increased intestinal permeability, which is the majority of the population, because
Yes.
the majority of the population is eating processed food. So even the landscaper, I mean, I've seen people in my private practice that work outdoors that are still deficient in vitamin D. The doctor that I was interviewing this morning, who's also in functional medicine, but does chronic pain, she was saying that the same thing that you just said and that I just said, like we see tons and tons of people with low vitamin D. She was saying she saw someone recently with a level of 1.
Wow. Wow.
I have not seen that before. I've seen people in the teens and the high, like just below 10, but I've never seen anyone with a 1. I didn't think that was compatible with life, actually.
Wow. Yeah, I've seen people in the low teens and wow, 1's pretty bad. But yeah, the way to figure out if you're taking enough vitamin D is basically get a serum blood test, which, any doctor can order. Because some people, because of varying absorption, need different doses. Some people do well on 2,000 IUs daily. Some people need 5,000, and once in a while I see somebody who's taking 10,000 daily and their levels are still, pretty low.
That's all. I mean, a lot of it hinges on the leaky gut, because if they have leaky gut, they're literally leaking the vitamin D too, and it's not going where it's supposed to go.
Absolutely.
Yeah, but that was the vitamin D piece is very, very important for people of color. What can they do once they get sick?
Okay. So if you start with a sore throat, if anything, you suddenly notice, I've lost my sense of smell. I can't smell this. I can't taste that. Those might be early warning signs. Because a lot of people don't start with the fever. They might, but the fever tends to come, a few days later. But once you start to just not feel normal, or even if you're just extra tired, don't wait for more things to develop. start increasing the vitamin C, start increasing the N-acetylcysteine, and also you can do what's called a bolus dose of vitamin D. And some studies recommend a higher dose, but I'm conservative, so I say take 50,000 units of D just as a one-time dose. And this 50,000 can be repeated, for up to 2 or 3 days if things don't improve. So for vitamin C, most people are taking, say, 250 to 500 milligrams twice a day, and that's sort of a usual dose of vitamin C. When symptoms start, that's when you bump it up to at least 1,000 to 2,000 twice a day, and some people are even doing it to bowel tolerance, which means just, slug it down as much as you can and stop short of giving yourself diarrhea. Mm-hmm. And the same thing with NAC. The so-called usual doses are 600 milligrams twice a day. When you start getting symptoms, bump this up. I might not bump it up right away to the highest dose, but say increase it to 3 times a day, and then double it to say 2 of the 600 twice a day, and then do that 3 times a day and go up to, even a total of 4 grams a day, but don't take that 4 grams all at once, divide it throughout the day.
That's excellent advice. And that's exactly what I'm recommending people. And it's interesting that you and I both do the same bolus type of thing, the conservative thing with the vitamin D. Although I find that, like, most people tolerate vitamin D, but the media or the conventional medicine has made people kind of afraid of vitamin D. But people having problems with it is so rare that I've actually never heard of anybody having a problem with vitamin D.
That's still a safe dose. Now, the other thing people can do is also to get zinc. I like zinc picolinate, but certainly there are other forms of zinc that people use, but picolinate is the ones that most integrative doctors use. So zinc does inhibit viral replication, but to do so, it needs to get inside the cell. And zinc by itself is not very good at getting inside the cell. So we have these things that are called zinc ionophores, which is just a fancy word meaning, like a tunnel in the cell that helps the zinc get in. And interestingly enough, chloroquine, which is the drug that people talk about as being a cure, is a zinc ionophore. That's certainly not the only mechanism of action, but it's, an interesting little bonus. So, good luck getting chloroquine, plus it's got lots of side effects, but guess what? There are other things, natural substances that are also zinc ionophores, and one of them is quercetin. Quercetin can be, and there's more that I'll talk about in my book, but quercetin's pretty basic. It's available as a supplement. It's not all sold out, unlike vitamin C. And it's found in food. Onions. Onions are rich in quercetin. Your grandmother's chicken soup. Chop the carrots, chop the onions, put that in. Even before you put the chicken in there, it's already good for you.
And then the bone broth from the chicken is good for the leaky gut. So
absolutely.
Yeah, you can hit a lot of the bases with the grandma's chicken soup. But I think if nothing else that people get your book for, they should consider getting it just to learn about the ionophores. I was just talking to a nurse that I worked with earlier today about that, and she had not heard of that. So I don't think most people will have heard of that, and it's valuable information because I think a lot of people are taking zinc, but they don't understand that, and they need to understand it. I wanted to also ask you about your patient population, and you're affiliated with a clinic that does Suboxone, and you do treatment on telemedicine. So what's going on with that right now?
So, the clinic's in Centerville, Virginia, and usually patients come into the office and I see them through secure video with them sitting in the office. Now, since everything is closed, we've not been able to do that. So the entire office has transitioned to telemedicine. They use a secure telemedicine platform called DoxyMe. I'm seeing the patients directly from wherever the patient is, be they in a parking lot or in their house or wherever, and we're continuing to prescribe for them so nobody's going into withdrawal.
Mm-hmm.
And they are taking new patients during this time.
Yeah, and I forgot to mention that Suboxone is a way that people can be weaned from opiates.
If anyone is on opiates and, legitimately on opiates and, can't see their doctor or their doctor won't prescribe them, it is, better to try and get on Suboxone than to go into withdrawal. Of course, ideally, their doctors should not stop their medicine.
And we were talking about earlier too that people shouldn't abruptly stop opiates right now.
Correct. It's very rough on your body.
That could make you more susceptible to getting the virus too.
Absolutely.
Mm-hmm. And with the Suboxone, you probably don't want to be missing doses, right?
Yeah, people can miss a dose for maybe a day or two, and then by day or 3 or 4, they're definitely going into withdrawal.
What are you doing yourself to maintain your health?
I'm taking most of the vitamins I talk about in my book, and I also am blessed by having a home ozone machine, which I've been using.
Mm-hmm.
So ozonated water is something, anyone can do with no skill. You just need to purchase the ozone machine.
Mm-hmm.
I'm fortunate that, I know how to do IVs. So I've been doing, a couple doses here and there of actually IV ozone. And that's made a huge difference. I've actually been exposed. Somebody in my house has been sick for over 21 days, and we're not isolating.
Mm-hmm.
We're still in the same room. We talk. We're petting the same cat to get together at the same time, and I've not been sick doing all these things.
With the ozone, care to say anything else about that?
I think it is the best thing that anyone can buy. Yes, it is a bit of an upfront investment. Yes, it can cost you as much as a top of the line brand new smartphone, but it's well worth every penny.
Mm-hmm.
If you can't afford it by yourself, find friends, find neighbors, pool your resources, have an ozonated water party every day, or share the resources.
Yeah,
Ozone,
that's a great
ozone, like
idea.
Ebola. We're not just looking to survive this round of coronavirus, we're looking to survive the next pandemic. Guaranteed it's going to come.
Yeah.
So, this is an investment.
People can look on YouTube, like for videos by Dr. Rowan, Dr. Schellenberg, there are a variety of people talking
Absolutely.
about
There's a lot of good information out there if you know how to find it. I do
Mhm.
have some links in my book as to where people can start to look for information, but it's definitely out there.
Okay. Excellent. Excellent. Yes. So where can people find your book?
My book is found on Smashwords, and right now there's a 30% discount coupon there as well.
Wow.
Because I want people to be able to afford it. I want people to be able to read it.
Okay. Okay. And the title is?
Surviving Coronavirus.
Great, great. And this is Dr. Sue, spelled S-U, Fairchild, spelled like it sounds, and she's a medical doctor. So please go and look for her book, Surviving Coronavirus, on Smashwords. And thanks for joining us. Thanks.
My pleasure. Thank you.
Dr. Sue. Thanks for coming on today. I really appreciate it.